Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz Podcast will surely satisfy your podcast fix.
Hello, greetings. Welcome to another classic episode of the Fuller Butz Podcast. I'm your host, Dr. Sam Fuller, and with me as always, Dr. Daniel Butz from Milwaukee, Wisconsin, and Quintessa. Dr. Butz, how are you feeling today?
Feeling good. It's been a busy week. Had some great post-ops. I had one patient a couple days ago who came in and I was pulling up her before and after photos. I'm like, is this you from before? She didn't even look like herself. And she's like, yeah, I didn't recognize myself then. This is what I used to look like before twins and 3 other pregnancies. So sometimes we meet the patient kind of when they're at their least confident, and it's really fun to kind of watch them kind of reclaim their confidence and what they used to feel like. So their muscle separation was nice and tight. She was feeling strong again, and we've been working out and lost maybe another 10 pounds and just feeling great. So that's what it's all about. How's your week been?
It's great. Yeah, I had a patient not this week, but a couple weeks ago. I emailed her before and after pictures, and she was like, "Yeah, I almost emailed you back. I was showing them to my husband that you had sent me the wrong patient, but it was actually me. Like I forgot that's what I looked like."
Yeah.
And so that's really
why we take the photos.
Yeah, why we take them and what we live for and want to accomplish is that really transformation that's there. Quick question, rectus plication, you repaired the rectus diastasis. How long do you estimate patients get back up to full strength, like really feel like their muscles are strong again? And usually we take restrictions off at 6 weeks, but how long does it take for them to really feel like they're toned and their core is at the finish line, the final result?
Yeah, I mean, it's probably closer to 3 months in reality. It's normally 6 weeks to kind of ease back into it. And I often encourage them to be kind of cautious with, certain things that feel like it's pulling funny. You kind of try to be more static, kind of playing exercises to kind of get it back up there. And then, things still feel funny for probably another 4 to 6 weeks. So average really starting to push is probably 3 months. And, that normally at 6 months are really starting to tone things back up and really feeling all the benefits. A lot of the functional things of back pain are improved pretty quickly though.
Yeah, I agree. I think the symptom relief is quick, but I've had some patients take 3 or 4 months and, kind of worry a little bit. And so they just give it time. They're feeling almost like tightness.
I think they're always scared they're going to stretch it out too. It's pretty robust repair.
Yeah.
But not something they've ever done before. So it's normal to have some nerves about it.
For sure. Well, this episode is supposed to be a quick hitter. One of the most common surgeries that we do is breast augmentation. And there is some decision-making that goes into choosing the implant besides just the size. So after surgery, a lot of my patients in the recovery room wake up and say what size, how many cc's, what did I get? As we're talking through this very narrow range that's there. And besides the cc's, there's some other components that go into selecting the perfect implant. Dan, do you want to take us through some of the thought processes in choosing the correct breast implant for breast augmentation?
Yeah, so it can be kind of confusing. There's a lot of terminology out there. Some people come in and go, I want mod plus, high, full, extra full, demi, minis, there's a lot of different, every company has their own verbiage. So the profile of the implant really comes down to let's say that 300 cc's they're packaging in, how wide they're going to make it and how much projection. So different profiles, they'll kind of start at a base width of 9.5, I think is as narrow as most of them get. Then they kind of work themselves up in typically quarter centimeter increments and add extra volume with more projection. So if you let's look at Motiva's, they use the mini, demi, and full as their profiles, the same 10 centimeter width, in a mini would be, I don't know off the top of my head, probably 205. In the demi, it's probably 278 or maybe, I don't know, 300. And full is probably maybe 375. So incrementally you add volume, the width is staying the same, but the profile projection, how much it projects out, is increasing. So as we're sizing patients and they're adding volume, in my mind, I'm kind of moving up in the profiles based on their base width diameter that we measure. And I'm sure during the consult we have visuals so they can see that, different kind of projections, but ultimately we want it to fit their body, right?
Yeah, the base width, I tell them it needs to fit the footprint of the breast. So as long as we're placing it into the breast envelope and we're not trying to make it so small that it's going to be sloshing around, not being too conservative, or making it too wide, we're just going to make them boxy or extend beyond their frame, it's going to be a perfect implant. Within that size range, within that diameter, that base width of their breast, that's where you get into the goal pictures and like, do you want a sporty athletic? Do you want B cup, C cup, D? Do you want to be as large as you possibly can? Which fortunately in my practice in South Bend, Indiana is not a typical request, but actually have the mini, the demi, the full profiles on the table so they can visualize what that projection difference is and go over with them that a mini is better for a smaller athletic fit type of profile, or for a patient who already has substantial breast tissue and just wants a little bit more upper pole fullness. The demi or moderate is really the classic, full C, or getting that upper pole fullness restored, rejuvenating in a natural type of appearance. And then the full high profile implants really for patients who want additional size within that frame and maybe want a more augmented look, or wouldn't mind if people know that there's an implant that's there. I actually bring up on the website for Motiva, which is the company that we're talking about right now, just to show them the base width diameters and what that means once I measure them, and usually just tell them that, like, let's follow the math, let's follow the numbers. And it's quite intriguing when we're really trying to narrow down what's the perfect size. Let's say 360 is what I'm saying is ideal for their base width, and they really want something larger. They're like, oh, I really want the 380. And I go and show them that adding 20 cc's really changes the projection, how much it's going to stick out, like 1 millimeter, 1 or 2 millimeters. And so it's really changing the width more than it is the projection. And for them to understand that they can get a very similar result or even the same amount of projection, whether it's a 340, 360, 380, it's really is helpful for them to not worry so much about the number of cc's that they're getting as opposed to just the anatomical rejuvenation that they're getting with that implant. How do you decide profiles, or when you're kind of in that range of not just choosing between a mini versus a demi, but also just getting down to the actual cc?
Yeah, so I think one thing that's often overlooked, sometimes patients will come in for their second pre-op appointment for sizing, and we had talked about, let's say, doing a mini. Like, I talked to some friends and I really like these demis. And I was like, well, if you like 250 and that so it fits your base width, if we just move you to a demi, the implant gets a lot narrower. And we often forget that it's often not really discussed. We often talk about the width of the implant, how narrow it is, but it's also the height. Most of the time we want upper pole fullness. So a lower profile implant, if it fits your chest, will give you more width, will give you more upper pole volume where you want it. Especially now with these newer, the Motiva ergonomic, the round, the round mini can give you great upper pole fullness because it keeps that volume up top. And so, I often kind of show them how that volume is going to sit, where it's going to sit. And you actually, sometimes a mini is going to give you better fullness than a higher profile that's the implant's all too low, or the fullness is lower. So, typically it's, when I'm picking out or helping the patient pick out that profile, the size, it's, looking at their goal photos, looking at their anatomy, determining the base width, letting them size. So I definitely want them to feel that extra weight in a sports bra, get that kind of, I like to get to the size that feels too big when sizing. If they put in a 200, like, oh, this is perfect. Well, try on the 250. That's perfect too. Try on the 300. I want to get to a size that kind of hit that ceiling. And then we often kind of will start looking at that chart and say, well, probably, a demi. You could do 280, 260 if we're kind of in between there. There's an asymmetry. Sometimes I bring both. And kind of, we don't lock it ever in the first consult, but then kind of, narrow that down at that next one. And then oftentimes I'm like, this is very much in line with your goal photos, or I'm like, this is a lot bigger than your goal photos, or a lot smaller. You're kind of trying to make sure, playing devil's advocate a little bit, especially normally if they're getting too big. And occasionally if I'm like, if someone has really tight skin, really tight envelope, I'm like, there's a limit to how much we can put in, without just disrupting the boundaries of your breast. We don't want to, run the risk of bottoming out or lateralization and things like that. So you want to respect those limits as well.
I think goal pictures are helpful for some of the projection, and then also just having them size up with the sizers that we have in the office, as you alluded to. I usually like to go too small and too big. So like, this is what's not enough to fit your pocket. And then once they're happy with it, go too big, and then really have a size range that might be a little bit too big, might be a little bit too small. And do you want to be closer to the too small, to the too big? And that's where we can really fine tune it. And so one of the important additional questions that need to be answered besides the amount of cc's is projection. We talked about the mini, which is a lower profile, but really packs a punch. The demi, which is a moderate plus versus a full. Another question that needs to be answered is the thickness of the gel, the amount of viscosity. And if we're staying with the Motiva implant, they have an ergonomics and a round. Dan, can you describe, or how do you tell patients, the difference between those? And we can, you and I can maybe go through the pros and cons of both the ergonomics and the round of the exact same size and projection implant.
Yeah. So, I have, an example of I think it's a 340 demi and an ergonomic round. So I just show them and let them feel them. It's kind of subtle. The feel is very subtle. Round's a little bit firmer, ergonomics a little bit softer, but a lot of times they can't tell the difference unless I really kind of point it out. And the bigger thing is kind of how it reacts to gravity. So upright, the round kind of maintains its shape a little bit more, has a little bit more upper pole fullness, a little bit less kind of, descending of the gel. The ergonomics designed to be a little more teardrop shape. So it gets a little bit more of that natural slope. And I think, again, some people think, teardrop, it's going to look really natural. You're still going to get upper pole fullness. It still helps a lot, just a touch more natural than the round. So then I kind of talk about, you can look at the goal photos and talk about, what they were telling me in the room, and the size they're looking for. If someone, sometimes we'll use a round, even someone wants a really natural result. If they want a smaller implant, they still want to get the upper pole fullness. So I'm kind of 50-50 on the ergo versus round. Patients really, it's not, one isn't a huge favorite over the other. It kind of just really case dependent on what we're recommending, and they both provide great outcomes. How do you kind of show that to patients? Is it sure it's similar, like everything else?
Similar. I have the round and the ergonomics. And I tell them I oftentimes have to look at the back just to make sure that I'm showing them the right one, because they are fairly similar. For patients,
I'm not really thinking about it. I have a hard time. I have to take a second to feel.
And so for patients who have a lot of breast tissue already, oftentimes I say it may not make a big difference on someone like you, because it's going to be, oftentimes underneath the muscle, underneath the breast tissue. And so let's not stress about this decision. For patients with very minimal breast tissue, really go through, ergonomics being the more natural. And I kind of hold it up to them, hold it up to my chest, and show them that the ergonomics, maybe 40% of the volume stays in the upper pole, 60% goes to the bottom pole. So that has that natural teardrop consistency. And I describe to them that the round is more of like a 50-50. So about half of the implant stays in the upper half of it stays in the bottom half, has a less natural teardrop shape, more of a Velcro kind of stuck on appearance to that. If they really want that upper pole to be volumized, that may be a better option. For many patients of mine who want extremely natural, want it to move and feel just like breast tissue, it's an easy, we're going to do the ergonomics. It's a no-brainer. For some of the patients who maybe want to be larger, but not necessarily a larger projection, want to maintain the volume, oftentimes the round is a good option, because it's going to give them that perkiness or that fullness without actually adding more volume to them. And so sort of you use that as a nuanced way of providing them with that perkiness without having to add more width or cc's to that.
I was that last week? I took out some 650s that were like style 45s like 15 years ago. And I replaced them with 360s, demis, round. And then, I have a picture of it, side by side on the table. And the round almost has as much projection as the 605, but the 605 is like, that kind of old scooped out. So that the implant technology is like so much better, provides so much better structure and shape. You don't need to use these really big implants that are often weighing down the breast, causing a lot of issues. So, you can get a lot more out of less volume than we used to, because the volume stays where you want it. So, it's a pretty huge improvement in technology.
Yeah, the safety of the technology is huge, and they pack a punch. So the Motivas are filled 100%. I think that matters as opposed to the older ones, which were 92, 94% or so forth. And it's just like you have to put more of the implant in to get the same desired result, as opposed to these. I kind of describe them almost as European style, but like they just give you that volume that's there. I similarly had a case. She thought that they were too big when they were put in 10, 15 years ago. She wanted them swapped out. I think they were 475s, high profile. And I put in the 380 sizer and it looked identical, if not like a little bit bigger. And I was like, luckily I had, have a ton of options. I was able to downsize, but usually I anticipate downsizing about 100 cc's to get them down a couple, size or get them more moderate, but ended up, I think, with 340s instead of the 380, swap out, just to give them truly a smaller appearance to the breast, because the 6th generation implants that we're using now, as opposed to the 3rd or 4th that were in there currently, have similar projections. And that's an interesting, tool in our toolbox to keep in mind. And it's fun. It's exciting to be able to see those differences in real time.
It's really,
and be able to make that.
I think we'll talk about this in probably a future episode, but with the preservé technique, where they're putting this, the implant in this submammary kind of ligamentous space, they're even describing using smaller implants and with same Motiva implants, but even less than they would typically use with Motiva, and getting similar like outcomes because of how it interacts with the breast. So I think, again, bigger implants cause bigger tissue changes, gravitational change. So if you can get similar like results with less cc's, it's totally worth it for that long-term result. So I think that's a great overview. I think that a common question we get is again what that profile is, why really want to match their base, their footprint, so it fits them, their anatomy, and achieves their goals. Great quick hitter here.
Yeah. And so, we're helping guide and navigate to a common goal with our patients, want to reach those expectations. Oftentimes, if they're saying things are looking too big, we're going to downsize the projection to give them the same width that fits their breast footprint. If they want more fullness, then we'll upsize the projection, and then the actual gel consistency, the thickness, is just another tool that we have to offer patients, especially with Motiva, the ergonomics and round, to help give them that lasting shape and appearance and feel of their breast that they're desiring. So it's all patient driven, patient centric. It's great to hear the ways that you describe those to patients and may steal some of those ideas.
Likewise. Awesome. Well, we'll always good to get on here and chat and get your perspective, and again, keep on following us.
How do we do that?
Other side.
No.
Oh, we're backwards.
We'll have to delete that. We'll edit that.
We'll end on that. See ya.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @SFullerSurgeryMD or @DanielButzMD. That's Butz with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.